Hello there, my name's Dr. Jim. Thanks for stopping by. My topic today, reducing staff bias towards LGBTQ residents in senior care. Good topic. The senior population, as you know, in the United States is booming, with an increase in many adults who consider themselves or identify as lesbian, gay, bisexual, transgender, and questioning. Many older adults and seniors will find themselves in need of some type of care later in life, either through home health care, assisted living, skilled nursing, or hospice. The aging LGBTQ plus population has known health disparities, as well as experiences of bias, stigma, and discrimination. Many individuals fear these will follow them in to care when they need it most during the last few years of their life. This is not to say that senior care staff are going to mistreat anyone in senior care. In fact, most providers go out of their way by making commitments to good quality of care. The type of bias that may affect care and services is not always conscious, but unconscious or implicit. That's what we're really talking about here. Not mean healthcare professionals, but somewhere in the cracks and crevices of their mind, they may be biased. It is therefore important for healthcare professionals and caregivers to address their own internal biases towards people who identify as LGBTQ+, so they don't contribute to increased disparities in health and quality of care. Such disparities are associated with earlier health services experienced by the LGBTQ community. They may have had such a negative experience early in their life with a healthcare professional that they simply stopped seeking care. They didn't go for their annual checkups and more. Perhaps they experienced perceived discrimination, but it was powerful enough for them to end preventive care, which is so important for every human being. Professional caregivers should be made aware of the experiences of the LGBTQ plus senior population in order to better understand their current physical and mental health status. This can take place with good, sound training programs aimed at focusing on our own internal implicit bias. We are all only human after all, right? So we do carry these biases and negative stereotypes and a little discrimination here and there, either consciously or unconsciously. But the more we learn, the more we understand, the more we appreciate some of those biases and stereotypical ways of thinking and discrimination can melt away with better training and education. Or at least we would hope so. It's been found in the research that even brief training can make a difference and reduce bias. Training programs can include education about the LGBTQ community, aging, unique physical and mental health needs, and how to gain trust. So important in a caring relationship. It can also include promoting contact with LGBTQ plus individuals and experiencing intergroup contact in the real world. Everyone has biases. Doesn't matter how many degrees we have behind our name. They're learned throughout our lives. They're reinforced throughout our lifetimes. Healthcare professionals, though, are special people. They must do their best to become more self-aware of their implicit biases because they are in the business of caring and delivering much-needed services to an aging population that is in need. High-quality care has no room for discrimination, stereotypical thinking, or biases of any kind. So, food for thought. Chew on that. I'm Dr. Jim, and keep coming back for more mental nutrition.